Hello future nurses and medical enthusiasts. Welcome back to medico.x.nursing. पिछले वीडियोस में हमने ईयर को कवर किया था. Today we will talk about the first entry point of our respiratory system, that is, the anatomy of our nose, its functions, physiology, and common disorders. So let's understand in detail. First, let's talk about anatomy. Our nose has two main parts, the external nose, which is visible from the outside, and the nasal cavity, the inner part. Let's explore the anatomy of the nose. The nasal septum divides it into two nostrils. Inside, cilia and mucus filter the air. This keeps the air warm and clean. Respiration. It warms, moistens, and filters the cold, dry air from outside so that our lungs remain helps us in smell. And the hollow spaces in our face give resonance to our voice. Now let's come to disorders. The most common is rhinitis. In common language, sardi zukham. In this, the mucous membrane of the nasal cavity gets inflammation, which can be due to viruses or allergies. If you're suffering from these, runny nose, sneezing, and nasal congestion, you should consult your doctor. A common disorder is sinusitis. We have 4 pairs of paranasal sinuses. They fill with fluid or pus when inflamed. When the lining of the sinuses gets infected or inflamed and they fill with fluid or pus, it is called sinusitis. इसके main symptoms हैं severe facial pain, headache, fever, or thick yellow या green nasal discharge. In nursing practice, epistaxis, meaning nosebleed, is seen very commonly. Inside our nose, there are many fine blood vessels. Remember to lean forward and pinch the soft part of the nose. When these vessels rupture due to dry air, trauma, or high blood pressure, bleeding begins. Here is a quick nursing tip for treating nosebleeds. Always tell the patient to lean forward and pinch the soft part of their nose for 10 to 15 minutes. This is so blood does not go down their throat. The last important condition is deviated nasal septum, or DN. As I mentioned before, the septum divides the nose into 2 parts. When this bone cartilage to one side, it blocks the airway on one side. This patient has difficulty breathing and gets sinus infections frequently. A deviated septum often causes these recurring problems. A permanent treatment for this is septoplasty. It is a minor surgery to restore airflow. Friends, this was the basic anatomy of the nose and its common disorders. A nurse should know about these conditions so that she can provide proper patient care. If you understood today's topic, then like this video, share it, and definitely subscribe to Medico X Nursing. See you in the next video with the topic of Keep Learning,